that there are a lot of things that are just moving together to help us be successful. Let me tell you, as many of you know, just 3 months ago I was just a doctor. I happen to be president of Healthcare for All Colorado. And we were at the Physicians for a National Health Program conference, and I talked about how disappointed I was that I wasn't going to be able to find a legislator to help us move forward with our agenda. And at the end of that meeting, someone came up to me and said, you know, my legislator is resigning to run for mayor, and I'm on the committee to pick his replacement. Maybe we could get someone who would run a bill for us. It turned out her legislator was my legislator, and that meant I could be the person to run for that seat. And I went for it. And when people ask me why I did that, what I always say is that I passionately believe that access to basic health care is something that we in the United States should assure for every one of our residents. And that it's shameful that we're still letting people die while other people are making billions of dollars. Now, I'm not a socialist, I'm sorry to tell you, and in spite of my position, I don't believe that government can do this right. So I do agree with the other side in some ways, but I think we, the people, working with our providers, looking at our health and our outcomes, can do it right. And that's what I'd like us to do. I'm feeling a little bit like, and I hate to say this because maybe I'll jinx myself, but there are a lot of things that are working together in our favor. It started with my senator choosing to run for mayor and letting me get this seat. It progressed with me actually winning this seat, and I can't tell you how many people came up to me and said, nobody thought you would win. And I said, they must not know me. And then just today, we have two more stars that have aligned. First, I want you to know that the New York Times today is reporting that President Obama favors the idea of allowing states to innovate in healthcare reform. And he favors that starting in 2014. I think this is remarkable. I really feel like it's a little bit of, I don't know, magic, having that happen today of all days. And in addition to that, today I was told by the President of the Senate that he was supportive of my efforts and absolutely did not see them as contradicting our efforts to develop an exchange. And I think that's because he, like a lot of us, realize that there's more than one way to skin a cat. And in Colorado, we often like to do things in a way that's different from anybody else. And I think we're really in a unique position because I have to tell you, I've met a number of the legislators just in the Senate. I've not had the privilege of working with the people very much in the House yet, on both sides of the aisle, and a lot of our values are the same. We're concerned about people having access to quality health care. We're concerned about errors in medicine. We're concerned about physicians not wanting to practice primary care because they feel so much like they're just sort of putting patches on broken tires. And all of the legislators feel that. And what I'm hoping to do is talk with all of them about a way we could do this better, a way we could do it differently, a way we could do it that represents the people of Colorado and no one else in the nation. And so what I want to also tell you is that I had the privilege of attending a physician summit on payment reform on Saturday at the Colorado Medical Society, and there were 110 doctors out on a Saturday morning, including orthopedic surgeons, cardiologists, urologists, and diagnostic radiologists, retinal specialists. And they were given the choice of continuing to practice medicine the way we do now on a fee-for-service basis, which means the only way to make money is to see more people and do more things, or to change the model in which we practice to one that rewards keeping people healthy, keeping people out of the hospital, keeping people alive as long as possible. And they overwhelmingly, only 5 people wanted to stay fee-for-service. Every other physician at this summit was interested in changing how we deliver healthcare in the state of Colorado. So I really feel like the gods are aligning, and it must be in your favor, because I certainly don't deserve this, but in favor of the people of Colorado. And I think that when you're willing to do the right thing, when you're willing to talk to everybody who's interested in the right basic values, and the same, I shouldn't say right, the same basic values, and are willing to look outside the box and be innovative and creative, and figure out what are the obstacles and how can we cross those obstacles, that you can get it done. And I'm confident that if we work together, we can get this done. And I thank you so much for all your support.